Test. Welcome, committee and attendees. Welcome to Pinedale, Wyoming. We've heard lots of people say they didn't want it. Apparently, from what I'm gathering, is it's further from Cheyenne to Pinedale than it is from Pinedale to Cheyenne. Yeah, we travel that way a lot. But anyway, for those who are not here, welcome on Zoom. I see Senator Hutchings. I believe I see Representative Clausen. You're a long ways away on the wall, but I can see you over there, guys. Welcome. This is a part of my district. This is the far north end of my district up here in Pinedale. We were in Afton, which is technically not in my district, but it's not very far from my district last time. Next time we're a long ways from my district. But welcome. I hope you enjoy Pinedale. Beautiful area, beautiful country, beautiful weather outside so far. So enjoy it. And hopefully we can get done. You can go enjoy some of the outdoor things here. The agenda, although it looks fairly full, is going to be a little bit abbreviated today because a lot of people don't have everything quite ready. So we'll get what we get, and there are plenty of places to eat when it comes time for lunch. If you need suggestions, Representative Zolantro makes up. Just kidding. Just kidding. Okay. Representative Penn smiling. That's a good sign. Okay. Welcome this morning. Let's take a roll call, please.
Good morning, Mr. Chairman. This is roll call for the Labor, Health, and Social Services Committee, June 20th, 2024. Senator Barlow.
Excused.
Senator Bouchard.
Excused.
Senator Dockstetter.
Here.
Senator Hutchings.
Here.
Oh, she's on.
Here.
Representative Chadwick. Representative Clauston.
Here.
Representative Hornock.
Excused.
Representative O'Hearn.
Here.
Representative Penn.
Here.
Representative Trujillo.
Excused.
Representative Ward.
Here.
Representative Yen.
Here.
Chairman Baldwin.
Here.
Chairman Swanser.
Here.
We have a quorum, Mr. Chairman.
Oh, we came so close. We were going to go boating on the lake if we didn't have a quorum today. Okay, welcome. We have a script that we're supposed to read before every meeting. I don't think I've read it in any of my meetings yet. But basically it says behave, get along with others. News is that you know that I have a rule, those who have been to my committee meetings, that I have a rule: if your phone goes off during the meeting, you owe the committee donuts. Last meeting, which happened to be the mental health task force, somebody whose phone rang in this committee brought donuts to the mental health. Those who are on Zoom missed them. But we had donuts, and that member is not here today, so his phone won't go off. But please silence your phones. Please be nice to one another. Be nice to the committee. Committee be nice to each other, et cetera, et cetera, et cetera. We don't have a problem, even with our large crowds like we have today. We're going to open today by talking about provider enrollment and credentialing. Let's go to LSO. Anna, welcome.
Good morning, Mr. Chairman. What you have in front of you is 25 LSO 0032 Provider Enrollment Standards. A working group's been working on this draft since the April meeting. They've had a couple of meetings, and I'll just go through the bill. Starting on page 2, there are various definitions that those go through page 4. And then beginning with page 4, there are various requirements laid out for provider credentialing. In subsection A, a health carrier is required to notify healthcare providers applying for credentialing that they've received their application within 7 days of receipt, and the health carrier is required to determine if the application is complete. If it isn't, the health carrier must notify the healthcare provider within 30 days of receiving the application that it is incomplete. The notice must contain the items that are required to complete the application, and the healthcare provider must send the healthcare provider must send a completed application within 30 calendar days of receiving notice that the application is incomplete. If they don't, the timelines in subsection A restart. And then in subsection B, a health carrier must complete the process of credentialing within 60 days of receiving an application. The 60-day period pauses if a health provider receives notification that their application is incomplete, and will resume after the health carrier verifies that the resubmitted application is complete. In subsection C regarding reimbursement, a healthcare provider must have a contract in place between the healthcare provider and the health carrier before reimbursement will happen. Once the contract is in place, the health carrier must reimburse the healthcare provider for all covered reimbursable healthcare services provided by the provider, beginning with the date the health carrier received a completed credentialing application. And then there is a staff comment on page 6. The working group thought that the language in C still needs a little bit of work, and the committee may wish to alter that language. And I'm sure you're going to hear from people out in the crowd about that. Further on in the staff comment, the committee may wish to consider whether payment for services should be backdated to the date the application was received, or if a different standard should be used. In subsection D, a health carrier is not required to approve any application for credentialing. And then in section 3 on page 8, the Department of Insurance is required to promulgate rules providing for a uniform credentialing application. Dental and vision insurance are exempt from using the uniform application. Section 4 provides that nothing in this act shall require a health carrier to violate or fail to meet a standard or requirement of a nationally recognized accrediting entity. And then section 5 is an applicability section, and section 6 provides a split effective date. And I would stand for any questions.
Any questions, committee? Seeing none, anybody online? Let's go to Representative Clausen. I believe he can give us a little, maybe an update on the working group.
Thank you, Mr. Chairman. Working groups, we've met a couple times on this. The insurance carriers have been present, hospital association, the medical association. So it's been a great group. We've worked hard on this, spent a lot of time on this. I think we're pretty close to having full consensus on this. We still need to maybe talk a little bit about how the backdating piece would work. And besides that, I think everything is pretty much set and ready to go. So thank you to everyone for their work on this bill. Again, it's great getting experts in the room and hashing out what people see as problems, and they can take it back to their companies and continue to work on it.
Any questions for Representative Clausen? Go ahead, Representative O'Hearn.
Thank you, Mr. Chairman. In the military, we never ever backdated stuff. And I'm concerned about how backdating works in the medical field. If you could expound on that a little bit. I don't like saying, oh, when did we really sign this document? Thanks.
Representative Clausen.
Sure. Thank you, Mr. Chairman. Representative O'Hearn. So when a provider is hired, they have a license through the state. If I hire a new physical therapist to bring them to my clinic, they're licensed, they're starting to see patients. I already have a contract with the insurance carrier. The completed application has been put in. So as that therapist or that physician is allowed to see patients, we're believing that, the credentialing will happen, that the information through the licensing board was correct. So we're allowing those providers to see patients. And then we're asking that the insurance carriers, since we have a contract in place, go back and pay for those services. Otherwise, we're going to have patients who are not able to be seen by providers. So we're going to be hiring providers. We're going to have them in the clinic. And if we don't backdate it, it's going to limit the amount of patients that can be seen.
Yeah, further questions, committee? Seeing none. Thank you, Representative Clausen. Okay, that's going to move us on.
Thank
to
you,
some
everyone.
public
Wish I was there with you.
comments. Anybody? I missed that. What'd they say?
He was here.
He was here. Okay.
We wish he was here too.
Yeah, we wish you were here too. You could have gone fishing with us. Okay. Public comment. Anybody here or online who wishes to comment, please jump up in the seats. They're still cold. You could warm them up. Wow. Okay, anybody online? Okay, for anybody online, raise your hands. Going once. Going 1.5. Going twice. Not there. The lights are on, but nobody's there. Okay. Okay, see no hand raised. Okay. Well, this meeting is going much quicker than I expected. Okay, we're gonna close public comment. Committee. Any ideas on this bill? Go ahead, Chairman Zwanta.
Well, thanks, Mr. Chairman. I assume the working group will continue to meet, and I guess my only concern, if there's anything that they would like direction on from us as a full body, because from what I understand, Representative Clausen is kind of going it alone, hurting all the cats. And so I guess as long as all the cool cats are happy. Not that I want to open it one more time, but I guess if there is anything that, to help steer it in a certain direction or concerns that aren't, my ultimate concern is we don't want any surprises at our August meeting is, this came out of nowhere. We need you to make a decision. There's something this committee should be thinking about now. Please let us know or email us as these conversations move forward. But otherwise, I assume we'll see the final bill draft for vote at our August meeting, and hopefully everybody kumbaya at that time.
Yeah. If anything comes up, yeah, just go ahead and email us and we'll work it out beforehand. Is that fine with you, Representative Clausen?
Thank you both, Mr. Chairman. Yes, it is. And I'll stay in contact with the working group. If we need to have another task force meeting, we'll do that. I think just the backdating piece is probably what needs to be finalized before the August meeting. So I would expect one more working group meeting. And again, the group's interesting discussions, but has worked really well together.
Very good. And I would ask that before the August meeting, we're in June, maybe towards the end of July or the very first part of August, if we can get a copy of that final draft before the meeting, so we have a chance to look at it. I appreciate it. Okay, thank you very much. That moves us on to the next agenda item. We're ahead of schedule, which is very out of character for this committee. Music therapy, LSO, what do we have?
Mr. Chairman.
Go ahead. Who said, I'm sorry, there's too many voices. Go ahead, Representative.
Thank you, Mr. Chairman. I believe our committee declined to act on this. I'm curious why this is still a topic.
The agreement was at the end of the last meeting that they were going to get together as a group and come back and present any changes that may make it more palatable. And so we're giving them that opportunity to bring that back, and we'll consider it again. We may well say no again, but we didn't kill. We offered them the opportunity to get together with those licensing groups, since it was a little bit of a blindside last time. And so we're giving them that opportunity one more time to bring it back to us, and we'll look at it and vote on it again. Is that okay? Go ahead, also.
Thank you, Mr. Chairman. I created a short memo regarding where other states with music therapy statutes have placed their music therapy laws. During the April labor meeting, there was a lot of discussion surrounding where music therapy statutes should be placed in the Green Books. Of the states that have music therapy statutes, I believe there's 14 or 15 of them. 10 have provided music therapy with its own chapter. And then Maryland and Oregon have placed their music therapy statutes along with audiologists, hearing aid dispensers, and speech pathologists. Maryland provided music therapy with its own subtitle. And then in New Jersey, Ohio, and Virginia, those states grouped music therapy with counselors, social workers, and therapists. And Wisconsin placed its music therapy statutes within the Department of Safety and Professional Services. It should be noted that at the very least, in these states, music therapy had its own subsection, and I would stand for any questions.
Questions, committee? See no questions for LSO. Let's bring up public comment. Come on up, sir. A familiar face. Go ahead and introduce yourself and tell us what's on your mind.
Thank you, Mr. Chairman. My name is Andrew Schneider, here today representing the Wyoming Music Therapy Task Force. Seated to my right, your left, is Hillary Camino, the chair of the Wyoming Music Therapy Task Force. Since we're 2 hours ahead of schedule now, we actually have one other music therapist who is still in transit, hasn't gotten to town yet, who is going to join us for public comment. We also had a few folks from the National Certification Board and the National Association who are planning to join us. They may or may not be on Zoom already. They are. It looks like they are. So that's who you have in front of you to answer questions today. I did want to give you all a little bit of a update on the homework assignment, and thanks to Representative Ward, Mr. Chairman, for the question. I'll try and give a little recap of why we're back here today. So in Afton, you gave us a little homework assignment to work out with the professional licensing boards an evaluation of what the impacts are of integrating music therapy to an existing board. The initial option that we had been presented was the mental health board. We understood that there were some impacts they had concerns about. The chairwoman of that board testified in front of you in Afton that she thought the occupational therapy board might be an option we would look at. So we have looked at that option. We were asked to prepare statutory language. And so in your packet today, you will see under Chapter 40, the Occupational Therapy Act, an additional subsection in that just addresses music therapy that we would call the Music Therapy Practice Act. So we certainly want to thank the Professional Licensing Board staff and members of both of those boards for getting together and meeting with us, looking over that language. I understand the OT board may have provided you all a letter. It doesn't sound like they're any more enthusiastic about integrating music therapy under their board than were the mental health professionals. That said, the Music Therapy Task Force remains open to gaining licensure under an existing board or through whichever pathway you all see fit and best and least impact to the state. Our own analysis is that the licensure under the OT board would be the least impact out of the options we've been given to explore. But I'll just run you through some of what those impacts are. The primary impact is really the cost of staff time to update the websites, to put the licenses into the web software, to perform legal due diligence, and to conduct meetings for rules setting. After the initial integration, then those impacts drop off considerably. And just anecdotally, there are other states that have a task force for mental health or for music therapy, excuse me, where that group hasn't had to meet in years because that's just how few issues there are. The other impact that came up related to integrating with an existing board was sort of the legal risk of an action taken by a licensed music therapist against the board. And while this legal exposure is not zero, right? Like it's a non-zero number, given the relatively low numbers and given the track record nationally of very few incidences, it's a far more likely scenario that legal action taken by either a mental health professional or an occupational therapist against the board would impact the music therapists who are licensed under that board, increasing the fees. Finally, there's the impact on the governor appointed volunteers who sit on these boards. And so whichever board you would decide to integrate music therapy under, there will be additional meetings for that board to deal with the initial implementation. And then they, of course, will have a learning curve about understanding how they're going to work with another profession under there. And so I will turn it over to Hillary, who wanted to share some comments about the homework we've been doing over the last month and a half since we saw you all in Afton.
Go ahead, Hillary.
Thank you so much, Mr. Chairman.
Oh.
And members of the committee. I just wanted to really quickly give our gratitude from the Wyoming Music Therapy Task Force to the Occupational Therapy and Mental Health Licensing Boards for really collaborating and working with us during this process. It's taken a lot of patience and energy from them. And so we really appreciate their work on this with us, and to you all for your patience with us and for having us back here today to consider music therapy licensure. And I just want to reiterate why we're here, which is to increase access to music therapy services by qualified individuals across the state that will have a positive impact on Wyoming constituents across the state. So thank you.
Thank you, Hillary. One final comment, if I may, sir, and then I will turn it over to you all if you have any questions for us. But just in response to the memo that was presented to you this morning, I thought it might be helpful to think about this in terms of where these statutes have mental or music therapy licensure. So for most of these where they have their own chapter, the professionals are licensed directly under a department. They don't have a board. Where you see the states where it is grouped with the board, so Maryland, New Jersey, North Dakota, Ohio, Oregon, and Virginia, those are integrated into other boards. So there's sort of two flavors there. There's additionally, there are states, Wisconsin, California, and Iowa, where rather than a license, there is registration, or what we might know in Wyoming as title protection. And so those are also just a few fine details to add to the memo that's in front of you. And certainly, having explored the options we've been presented so far, we remain open to creative solutions that you might have. Thank you, Mr. Chairman.
Okay, committee questions? Questions for the presenters? Representative Penn.
Thank you, Mr. Chairman. So you're saying the point of licensure is to increase access. So, have you sought certification through like PTSB board rather than licensure with the school districts? The notice that we got from occupational therapy says that not being licensed is not the barrier, and that you can still practice in schools, and other fields do so without licensure, but certification through PTSB, has that been something that you have sought after?
Go ahead.
Thank you, Mr. Chairman, Representative Penn. I'm not in receipt of the letter you received, so I don't really want to comment on it and those details. We did have what I would say is a partial conversation about the access. School facilities was one part of that conversation, but I think there's a larger conversation about Wyoming's standing compared to other states, how we attract our music therapy workforce, how we handle them. I also just would comment that there are other reasons besides access for licensure, and even for title protection that can provide protection to consumers, so that they know that someone has a national board certification and that the state has verified that prior to allowing them to hang out a shingle that says they're a certified music therapist. Thank you.
Yeah, further questions, committee?
Just a quick one.
Go ahead, Senator Duffy.
What is, remind me, Wyoming standing? Can you put that in a nutshell?
Go ahead.
Standing in terms of,
You referenced Wyoming standing in comparison to other states. Where are we? Mr. Chairman.
I'm not sure if I said standing. Can you remind me the context? I'm sorry.
Mr. Chairman, you just said it. You referenced Wyoming standing. What did you mean?
So currently Wyoming does not have licensure for music therapists. We would seek to gain licensure, state recognition.
Okay, fair enough. Thank you.
Further questions, committee? Go ahead, Representative.
So, thank you, Mr. Chairman. Of the two placements, do you have a preference? And if so, why? Give us some of your feelings on this.
Thank you, Mr. Chairman, Representative Chadwick. We're really open. So we've discussed whether we would have a preference, but we think that our priority is to seek licensure through a pathway that has the least impact on the state. We understand that there will be impacts no matter what board you would decide to integrate us under. Looking at the feedback received from the two boards, there seems to be significantly less impact logistically and perhaps even cost-wise to integrate under the occupational therapy board as compared to the mental health licensing board, which has numerous professions already situated under them. But there may be even other ideas that we haven't explored yet that could be a better fit. So far, those are just the two options we've been presented.
Further questions? Oh, Senator Hutchins, go ahead, ma'am.
Thank you, Mr. Chair. Hopefully you can hear me well without much delay. I too was concerned about why this topic came back. I don't remember us saying, let's bring this back, let's discuss this topic more. I'm wondering if the two people at the chair or even the ones that may be online have approached an individual legislator to seek help via a specific person to help them push this particular licensure forward. And since this committee doesn't seem to have a real interest in dealing with this topic. Thank you, Mr. Chair.
Thank you.
Thank you, Mr. Chairman, and thank you, Senator. So my recollection, and I've slept since then, so take this with a grain of salt, was that after the vote on whether to move forward a committee bill, which failed by, I believe, one vote, owing to one member who was not in his seat to vote at the time, that we were given direction from the chairs of the committee at that time in the public session to work with the boards and come back with this. So there's not been any sort of back channel other than the direction we received at that Afton committee meeting. We certainly have provided to the chairs of the committee updates as those conversations have proceeded, as well as including your LSO staff. So you've had access to those updates as they've gone. Primarily though, Senator, our interactions have been with the state staff as well as the governor appointed volunteers who serve on those boards and not with any individual legislators.
Very good. And I would include that. That's my recollection as well. And that's the way I did proceed. And that we did agree to do more conversation on it. And if appropriate, consider a bill or consider moving with it. But to your point, Senator Hutchins, is that if there is an individual legislator, of course, we don't know which individual legislator will be here after August. That remains to be seen, right? We know a couple that won't be here for sure. But if it does not go forward in a committee, that would be your alternative, is to find an individual legislator to work with and move this forward.
Thank you.
So any further questions, committee? See none. I believe we got some people online who wish to testify toward this as well. Let's get the hands raised. There's several on our lists.
They're there, they're not raising their hand.
If anybody online wishes to testify to this subject, please raise your hand. This is your opportunity.
Raise their hand.
Go ahead and put her up in front of us there. I see some people showing up. Choose which one.
So,
Okay,
Miss Eamon.
Miss Eamon, you've been elected to go first, ma'am. Go ahead and introduce yourself and go ahead and speak to us.
Thank you, Mr. Chair. My name is Shelley Eamon. I'm an occupational therapist and I'm representing the Wyoming Occupational Therapy Association. We have met with the music therapy folks, had conversation, have done some of our own research. I did send an email out to you all, just citing some of our concerns regarding adding music therapists to our licensing board. And just to expand a little bit more on some of the research I did as far as access within the state, you have the information from the human resources person and the special education director in the Sheridan County School District. I also have found a practitioner in Casper who employs 4 music therapists, and they have been given access to provide services at the Child Development Center and WBI, Wyoming Behavioral Institute. And so it appears that not having licensing isn't necessarily preventing access to these services. In our opinion as WYOTA, this feels like there just needs to be more public education on music therapists, the use of it, prior to going down the licensing for 9 to 11 in the entire state.
Okay, questions? Representative Committee? Go ahead, Representative Yen.
Mr. Chairman, thank you. Ms. Eman, do you think that it is important for licensure for things like any type of therapist when dealing with children? I mean, I'm trying to understand what the pros and cons are. So if we don't have licensure, are there protections that we are missing for having folks who interact with our kids?
Go ahead, Ms. Seaman.
Thank you, Mr. Chair. Thank you, Senator. Excuse me. There are things that are put into place. If you work in public school system, they do a full background check. I would think that any employer who is employing people that are working with children are doing background checks to make sure that there are not issues that come up. I feel like it's also, due diligence on part of the employer or perhaps the patient seeking services to make sure that those therapists providing those services are indeed credentialed. Music therapists do have a national certification board, and so that is another way for people to ensure that they're safely accessing services.
Further questions, committee? Seeing none, thank you very much, Ms. Seaman. Who do we have next, Mr.
Thank
Chairman?
you very much.
Mr. Reed, Joanne Reed
Ms. Reed?
from the boards and commissions.
Ms. Reed, if you can hear me, go ahead and introduce yourself and present to the committee.
Good morning, and thank you, Mr. Chairman, members of the committee. I'm Joanne Reed. I am the administrator for the A&I Professional Licensing Boards. As Mr. Schneider stated, he has been working with myself and the executive director for both the mental health and the occupational therapy boards. I did provide some information to Mr. Schneider regarding cost estimates and also a white paper that kind of explains the process and the administrative services that are provided by the professional licensing board office. And I mainly just hear, it's my understanding he was instructed to share that information with the committee, and I'm here to answer any questions that the committee may have on that information.
Very good. Questions from Ms. Reed? Seeing none. Thank you very much, ma'am.
Thank you.
And next,
The other hands.
that's all the hands. Okay. Okay,
I don't think he heard you.
yeah. Representative Clausen, you're on, sir. Go ahead.
Thank you, Mr. Chairman. Question to the speakers at the table. Can you review for us what it takes to become a music therapist? What kind of education, what kind of testing, certification?
Go ahead.
Yes, thank you, Mr. Chairman. Representative Clausen. So you need to have at minimum a bachelor's degree in music therapy from an accredited university. And you must be board certified, which is a national certification that you take after an exam and you earn after an exam. So undergraduate degree at least, and board certification. And there's also, yes, you must earn hours as every 5 years to be recertified, and that's 100 credit hours for ongoing education in the field.
That's only hours. That's no more testing. Is that correct?
Correct.
Okay, further questions, committee? Go ahead, Chairman Swatcher.
Thanks. Ms. Reed did provide a memo to music therapists. It's included in our packet. It's 304X on cost. And so the estimate from A&I on what it would cost to administer the work for the board, they put as $17,000. Divide that by the number of music therapists in the state. I think there were 10 to 14. I don't remember, but it's, you know, a pretty hefty per person membership fee, right, to cover those costs. And so I was just wondering if the music therapist could comment if that seemed reasonable in their estimation, and they were willing that if we did make them a board to kind of charge each member of that board that level of fee.
Go ahead, Andrew.
Thank you, Mr. Chairman, Representatives Wanitzer. In that memo, Ms. Reed talks about her methodology. And so she's using, I believe, the last two, I don't have it in front of me, I'm sorry, the last two new professions to gain licensure. Those costs, in a follow-up email asking some questions about that, I understand that the primary driver of that number is the acupuncture board, which was the creation of an entirely new board. And so I think that while those costs are certainly based on fact and therefore not subject to opinions of reasonableness, it might be reasonable to think that the cost of integrating music therapists into an existing board would be less than the cost of integrating a new practice with an entirely new board and setting up that infrastructure. Did that answer your question?
Mr.
Go ahead,
Chairman, actually, no. And I appreciate that it might not be that cost, certainly to be combined with another board, as I think we're all well aware from listening. The other two most preferred boards are probably not superbly agreeable to this idea. So going it alone and being your own board on that estimation, is that something we think the music therapists have talked about and are willing to each pay $1,200 to $1,500 per member to proceed on their own? Is my overall question.
Go ahead.
Thank you, Mr. Chairman. You know, in looking at previous boards, there have been legislative appropriations to cover some of those initial integration fees. So that's an option that we considered is potentially appropriate in this instance. Certainly, the music therapists would like to see Wyoming's licensure fees at a rate that is on par with other states, around $150 every other year. So 10 times that would really make a statement about Wyoming's attitudes towards music therapists relative to other states, that we might have an unintended consequence of chilling the potential workforce participation in Wyoming over the future, and actually have the opposite effect of increasing access by pushing people to practice in other states. That said, it is the intention of the music therapist to not have this increased fees on other professions. We would hope to find a way to do that. And there have been examples at other states of the National Association making a contribution to the states. We obviously want to avoid any appearance of a pay to play type of situation where the state is just saying this is the cost, and if you have to be this wealthy in order to gain all the benefits and to protect consumers through licensure. We would like to pay what's fair, what's in keeping with the other states, which have not had, in our research, none have shown this incredible initiation cost.
Further questions, committee? Representative Penn.
Thank you, Mr. Chairman. You've talked a little bit about consumer protection a few times. So my question is, what do you foresee the damages would be to children or whomever is receiving this service without licensure?
Go ahead.
Thank you, Mr. Chairman. Representative Penn. So I'll refer back to the presentation we gave in Afton where we spoke in more detail about what some of those are. But the example that was that's kind of easiest to wrap one's head around is the example of somebody coming into a hospital room, not understanding how to interpret somebody's heartbeat and not understanding that they were becoming agitated as a result of them trying to just provide some calming music in the room. That person was not ambulatory, wound up getting out of bed, hurting themselves, hurting one of the nurses. I believe in that case that we referenced, that person actually wound up passing away shortly after that. The other example that we shared was in the NICU, where again, you have folks, music therapists through their certification and hopefully state licensure here in Wyoming. We're certain that they've been educated and tested on how to deal with folks who have dementia, schizophrenia, how to read those heart rate monitors to understand what's going on in the room. So, and again, this does not prevent someone from going to a senior center and playing a concert. This does not prevent those sort of non-therapeutic musical activities. It doesn't prevent music integration into curriculum in classrooms. We're really just focused on the narrow scope of practice contained under the music therapy scope.
Representative Ward.
Thank you, Mr. Chairman. So you just said it doesn't prevent others from practicing, although the proposed or the model legislation says that no person shall engage in the practice of professional counseling, clinical social work, marriage and family therapy, addictions therapy, or music therapy unless licensed or certified to practice. Now, I understand there are some exemptions under that, but I think that could be prosecuted as pretty broad. So can you speak to that?
Andrew, go ahead.
Thank you, Mr. Chairman. Representative Ward. My understanding is we've not seen in other states where licensure has that there's been that kind of conflict. And so because music therapy is pretty narrowly defined, about a quarter of the applications, if you think of this as sort of a complementary healthcare practice, music therapists are working with a psychologist, with a physician, as part of a care plan. That's what title protection wraps around. It doesn't wrap around other uses or applications of music. And because I'm not a music therapist, Hillary, if you want to add anything to that, you can help me out here.
Just to reiterate what Andrew was saying, Mr. Chairman, thank you, Representative Ward, for your question. It is defined in the language what the scope of music therapy practice is, and to just stay contained within that scope of practice just for the treatment of music therapy, not for the use of music and other therapies. That's fine. That's a completely different tool. And we want to promote that, and people should be using music in all aspects of our lives. But this is just for the treatment model of music therapy. We want to protect that so that people who are qualified to use music as a treatment model in a clinical setting are qualified to do that.
Thank you, Mr. Chairman. Just one other example that came up in the last meeting is when you're working with folks who have a diagnosis of post-traumatic stress disorder and you provide an intervention or care that is not responsive, you can actually do more damage and undercut the efficacy of the other treatments that that person is receiving. So you want to have folks who are certified in those areas if they're aiming the music at those diagnoses.
Very good. Further questions, committee? Representative Penn.
Thank you, Mr. Chairman. How do you currently get reimbursed for your services, and what does licensure do to change that? Does that suddenly open the possibility for you to be able to bill insurance?
Go ahead. Whoever wants to answer.
Thank you,
Go
Mr.
ahead.
Chairman. So currently, most of our music therapists in Wyoming are paid through grants and under general budgets and operating budgets. And outside of that, a lot of folks who are in private practice will be paid privately. So that's generally where we are funded currently. And the licensure doesn't necessarily widen the possibility of reimbursement. And it would be nice to have our national team here if they are online to comment on this as well, and what they've seen from other states. But as far as Wyoming is concerned in reimbursement, I see our funding models continuing as they have been.
Very good. Do we have any other national folks that are?
Here we got up yourself. Wasn't know quite yet.
I'm not seeing them go there again. We're ahead of schedule a little bit.
Ask another question.
Go ahead, Chairman.
And so maybe take me back back to 60,000 feet. So if it's not necessarily being able to bill differently, the overall, give me back to the basics of what's the reason you want licensure through the state board? If it's not financial, is it just acknowledgement? Or give me the why.
Go ahead, Hillary.
Thank you, Mr. Chairman. So there's a handful of whys. Our largest why is to protect consumers. We want music therapy to be a protected title so that people know that they are offering services that are protected and by someone who is qualified to offer those services, because we often work with vulnerable populations, people who cannot advocate for themselves. So it is very important that we know what we're doing when working with those very vulnerable populations in a clinical setting. So there's that. There's also increasing access. And when I talk about increasing access, this is by different programs in the state that are overseen by the state. I'm thinking of a specific example from our other music therapist who isn't here yet today. He approached the forensic setting in Wyoming, and since we are not a licensed profession in Wyoming, they did not pursue offering music therapy services with him. And so if we were a licensed profession, then we would gain more access into state programs. What else am I missing? And it will increase the legitimacy of the profession in Wyoming, so that other professionals throughout the state will see us as a qualified profession to work with these individuals and a licensed profession with state recognition. Therein increasing access. So a handful of reasons why licensure is important to music therapists.
Senator Dockstader.
Thank you. This one's probably Hillary, but Andrew too. So you want to get a protected title, increase the access, and make it all legitimate. Funding's already in place. So you're not asking anything financially of the state with this, right?
Andrew.
Thank you, Mr. Chairman, Senator. We have not had a conversation about any sort of appropriation attached to this. Over the last month, through looking at fiscal notes of maybe the last 3 to 5 professions, those bills coming through this committee, there were general fund appropriations for at least, I'm thinking of acupuncture to help with the costs of initial integration. And that fiscal note, you can see how those costs were allocated and how they were then appropriated towards ANI for the staff
Thank you.
time.
And just a quick follow-up.
Follow-up, go ahead, sir.
So I heard Hillary say we have funding methods already in place. Can we get this accomplished, get you the protected title, increase your access and take care of the legitimacy, making it legitimate? Can we do that with those existing funding mechanisms in place without asking for more?
Andrew?
I understand now. I believe what Ms. Camino was speaking to were the funding models for how music therapists are paid in their practices through grant funding and through that. So I don't think you were speaking to funding of the licensure costs that the state will incur. So that maybe is the disconnect.
Just one more, Mr. Chairman, and that would be an estimated cost of what? I think it'd be minimal, but what would you say it would be?
So looking at the costs in other states, I believe there has been up to maybe a couple $1,000s contributed by the National Association to help a state. And then what you're seeing is the actual license costs up front being on an annual average of about $150 per person. So let's say 300 per music therapist. Of which there are 11 who might seek licensure. So $3,300 coming in. The benefit of licensure versus title protection is that the state can recoup those costs through license fees, as opposed to title protection. The state does not have that license fee mechanism to recapture costs of implementing title protection.
Understood. Thank you, Mr. Chairman.
Okay. And none of our national people are, Representative Ward.
Thank you, Mr. Chairman. You mentioned protection of consumers as one of the primary reasons for this. Aren't consumers currently protected via tort remedy? I mean, consumers can be protected right now without licensure of music therapists. Isn't that correct?
Go ahead.
Thank you, Mr. Chairman. So Representative, in the statutory language, you see that there is a penalty for folks who represent themselves. So this provides for a penalty that the state can levy through the judicial system. In terms of existing opportunities for folks to go after folks who are not certified, who are saying that they are certified. I'm not an attorney. I can't speak to that exactly, but in the states where this language has been enacted, there is a bulletproof way to ensure that folks are not hanging out a shingle trying to go into a hospital or another setting to provide these services.
Chairman Swanser.
So let me ask a couple questions. First, every music therapist in Wyoming right now currently has a national certification. I think it's called an MTBC. And all people who would be seeking a licensure in the state already have the national credential. They're nodding, but if you'd say verbally yes for the audience at home.
Mr. Chairman, Representative Zwanitzer, yes, you are correct.
Okay, so if we can't get, thank you, Mr. Chairman, a board. So Iowa 3 years ago did something where they just said nobody shall hold themselves out. It's title protection, basically. And from everything I've heard up here and working with everyone, it doesn't seem like the board idea is going to fly this year as a committee bill, but a simple title protection that nobody can hold themselves out as a music therapist unless having this national credential in Wyoming. And I think 2 states have done something to just that effect. Is that a way forward that if you don't get the whole pie, that's a step forward you could appreciate this year? And committee, I think if you look in your materials, it's 306X is what Iowa did. You can quick, it's a 1-page bill, but go ahead, Mr. Snyder.
Andrew, go ahead.
Thank you, Mr. Chairman. Representative Zwanitzer, I think that certainly does get us a lot of the same protections that we're looking for. However, I'll just point out that it's the vast minority of states who have gone the title protection route as opposed to the licensure routes. There are some differences in the impacts, but in terms of consumer protection, that would provide for that portion of it. And Hillary, if you have any other.
Thank you, Mr. Chairman. There's also the option of having a registry where music therapists who are board certified are listed on the registry so that that can be accessed, which would be beneficial for music therapists and for consumers, mostly for consumers, so they know who can provide those services in the state.
Further questions, committee? Seeing none. Oh, Senator Hutchins, go ahead, ma'am.
Thank you, Mr. Chair. Question to the panel. How often each year are your services requested in any capacity? Thank you.
And I believe Senator Hutchins, you're speaking about Wyoming, would that be correct?
Yes, Mr. Chair. Thank you.
Go ahead.
Thank you, Mr. Chairman. And Senator, are you speaking about music therapy services and how often they're requested
Yes.
per music therapist?
Yes.
Okay. I can certainly speak for myself. I am referred, given a referral for music therapy services to provide music therapy services on a weekly basis. A handful of referrals. It's not consistent, as are most referrals with any profession, but I will get on average 2 to 3 a week. And that's on top of my current caseload, which is about around 20 individuals or groups a week. So 20 hours of work with individuals or groups in a week. And that really varies depending on the setting that you're working in. I work in a hospital setting, so I work with other therapists who provide those referrals, or nurses or doctors, depending on what the needs are in that climate at the time. And so it varies from setting to setting, from town to town. But we are seeing the need for music therapy continue to grow. I've hired another music therapist in Jackson, Wyoming, where I currently live, to take over my previous contract, and am seeing the need already, again, getting emails from other community members wanting music therapy services, but just not really having music therapists in Jackson or other places in Wyoming to fulfill that need.
Very good. Further questions? Any follow-up? Senator Dockbetter.
Where are you getting? Where are you getting those requests for music therapy in Wyoming? Where are they coming from in the state? Thank you.
Go ahead.
Thank you, Mr. Chairman. The referrals that I receive are from around Jackson, Wyoming. I've received some from Lander. Because I've been practicing the longest as a music therapist in Wyoming, I receive some referrals from other places in the state where I can direct music therapists who are living around their area. But we have a lot of blank spots as far as we don't have enough music therapists in the state to provide those services. So in Lander, for instance, I was not able to refer them on to another music therapist because there are no practicing music therapists in Lander currently. So it really varies, but most of the referrals I receive are around Jackson, Wyoming, maybe Alpine as well.
To further distill that, excuse me, those referrals, are they coming from physicians, nurse practitioners, OTs, PTs? Where are they coming from, Hillary?
Thank you, Mr. Chairman. They're coming from many different places. For the most part, for me, it's family members. So family members will learn about music therapy services and really seek out a music therapist to provide that for their loved one. And that's if I'm getting referrals outside of the hospital. Inside of the hospital, I get a lot of referrals from occupational therapists, speech therapists, physical therapists, nurses, physicians. And that's primarily who I receive my referrals from.
Thank you. Further questions, committee? Seeing none. Oh, Representative Clausen, go ahead, sir.
Thank you, Mr. Chairman. My question is really for Ms. Reed. Joanne, do we have any other professions where we see 10 or less licensees in Wyoming?
Ms. Reed, go ahead.
Thank you, Mr. Chairman, Representative Croston. The closest board that we have with a very small number of licensees is the Board of Midwifery. They have 17 licensees. They currently have a biennial budget of $26,973, which at this time is holding them steady. Their application fee is $1,200, and their renewal fee is $1,200 for every 2 years.
Okay, thank you. Further questions, committee? Seeing none, thank you. We'll take further public comment and we'll get back with you.
Thank you.
Is there any other further public comments in the room, online? Seeing none. None online, Katie? Okay. Committee, I sense, and this is my sense, which sometimes is right and sometimes is wrong, but you can slap me for that. My sense is that it's a will of the committee to probably not move on with adopting this into one of the existing license, such as occupational or behavioral health. But I do sense perhaps a desire or a question of moving forward with protectionism or protection of the license or creation of a registry. And my thoughts would be this, is that if we do move forward with something like that, that the music therapy folks do contact an individual legislator, and I think it's certainly something that could be moved forward, but it's something that needs to be worked on between now and the session. There may well be an individual legislator that's interested in that. Committee, any thoughts toward that means, or if you want to slap me, that's fine too. Go ahead, Representative Ward.
Thank you, Mr. Chairman. I agree with your assessment. I think it should be an individual bill, and I think we demonstrated that last time when we talked about it. Thank you.
Chairman's answer.
Mr. Chairman, I'm happy to move a bill draft that is what we'd call title protection, so nobody can hold themselves out as being a credentialed music therapist. I know that's not as far as they want to go, but I'm thinking that might be as far as this committee in the legislature wants to go this year. The sense that I get from our colleagues, especially with some of the new groups out there, are the work is to lessen licensing across the field. And there are certainly groups that work in our state. That's their primary campaign mission. I think that is going to be kind of a strong issue in the 2025 session of reducing licensing and barriers. And this draft we've had and kind of a concept is moving against the tide of where the legislature, I think, is going as a whole right now. And so, but the title protection, if anybody else would like to move for something in that caliber, I would certainly be happy to second it. Otherwise, I'll probably, if I get reelected, bring it as a individual bill. But committee bills are always fun too, Mr. Chairman. So if anybody else is going to move that, I would second.
Would anybody on the committee like to move that?
Or not, except there too.
Clarification, Mr.
Go
Chairman.
ahead, Senator Johnson.
I thought the good chair was making the motion to create it.
I would say either one of you can make the motion if you want the motion, and another one could second it, but go ahead.
I was afraid I didn't want to get a second, so I didn't want to do it.
Well, I'm afraid of a lot of things, so.
Representative Warnock is online with the hands up.
Oh, you guys hand up. Representative Warnock, you want to pitch in an opinion here? Go ahead. I can see you, Representative Hornock, but I can't hear you. And I still can't hear you. No, still nothing there, Representative Hornock. For some reason, you're muted and not getting through to us. But we did see the wave. Okay, Chairman Zwanter, Senator Dockstader, any motion or seconds there, or what's your pleasure?
You know, Mr. Chairman, I have no interest in carrying this as an individual bill, but I would like to explore the interest of the committee on the protected title. Because if that's there, that takes care of the access that they're seeking, the legitimacy of the program and the profession. So we'll see where this goes. Make a motion for legislation for a protected title for this therapy program.
And I believe that would be following the example for also of the Iowa, is that?
Yeah, Mr. Chairman, it's, I think, 3.6 in your online book. It's a simple, no person shall profess to be a music therapist or board certified and use those initials unless they are in fact credentialed.
Okay, so we have a motion and a second. Discussion committee. And I believe that's a one-page, actually less than a one-page bill.
In Iowa, it is.
In Iowa, in Wyoming, who knows? Discussion committee, Representative Ward.
Thank you, Mr. Chairman. I just don't see the need for this. I think it grows government, and for that reason, I'm against both the protected title and the bill that was brought before us. So I will be a no on this.
Very good. Further discussion, committee? See no further discussion. Vote on this motion. All in favor
It's to make it
to make this a
bill.
draft bill, correct? A draft bill for the committee. There's, I believe, Representative Yen's got his finger on the button there. No comment. Okay. So the motion is to move this forward to a draft bill to consider in our next meeting for title protection. All those in favor say aye.
Aye.
Opposed, say no.
No.
That bill pass or that move passes to have a bill drafted. We will discuss that in our next meeting in Cheyenne. Excuse me?
Division.
Oh, division has been called. All those in
Thank you.
favor, please raise your hands. 3, 4, 5, 6, 7. Okay, all those opposed, please raise your hand. That motion passes. Okay, so LSO, you got everything you need for that? Very good. Okay, since we're moving so slowly this morning and everyone's exhausted, let's take a break. And it's not going to be the standard 50. Let's see you back here at 10 a.m. Not enough time to go fishing, but enough time to do several other things. We'll see you back. Okay, we're back live. Welcome back to Labor, Health and Social Services. We left off having talked about music therapy. That moves us on to the Good Samaritan Law. LSO, can you lead us off?
Yes, Mr. Chairman. Luke Plum, LSO, here to discuss 25 LSO-0036. The bill is titled Immunity for, the catch title is Immunity for Drug Overdose Reporting. This bill is substantially similar to the one that we saw at the April meeting in Afton, but just for a quick run through. This bill provides that a person may be immune from criminal prosecution for possession or use of a controlled substance when they in good faith seek medical assistance for themselves or another person, if they reasonably believe that themselves or another person is having a drug overdose event, that the person can provide an actual description of where it's happening, that the person remains at the scene or at the medical facility until law enforcement or emergency medical service personnel arrive, and that the person cooperates with law enforcement and EMS, including providing information on what type of substance was used, and that the offenses listed that that the person can be immune from prosecution for arise from the same events as the drug overdose event. This immunity does apply, it's specified, does apply to the person experiencing the drug overdose event, and it does only provide immunity for 2 crimes. So it is possession of a controlled substance under Wyoming Statute 35-7-1031C, and then use of a controlled substance under Wyoming Statute 35-7-1039. I guess it's important to note that, a drug overdose event just means a condition including extreme physical illness, a decreased level of consciousness, or respiratory depression resulting from the consumption or use of a controlled substance or a combination that would require or would, a reasonable person would believe would require medical assistance. Notably, good faith does not include seeking medical assistance or immunity under this bill as a result of using a controlled substance during the course of a law enforcement agency's execution of a search warrant, arrest warrant, or other lawful search or arrest. Nothing in this bill prohibits the criminal prosecution of a person for an offense other than those that are specified that you can be immune from. And it does not limit the authority of law enforcement to obtain or use evidence from a report, recording, other statement for crimes other than what is included in this bill draft. The possession or use of a controlled substance. There are just a couple conforming amendments in this bill draft, primarily in the definitions, and then kind of different from the previous bill draft. Have included both 35-7-1031. These are the 2 criminal offenses that someone can be immune from, and just providing that, except as provided under this bill draft, it is illegal to use those substances. This is just kind of a, making sure that that is all conforming. And then, this bill is just effective July 1st, 2025. With that, I'd stand for any questions.
Questions? Chairman Swanser.
Thank you, Mr. Chairman. So, and you might have to remind me, distribution is still an offense. So if someone would give their friend an opioid, they can't be charged themselves with possession or use, but they could still be charged with distributing the narcotic to their friend when they call, even if they do everything right. And I guess maybe my question is that correct? And are there any other, I'm not sure if any of you guys do criminal law and LSO, but are there other general statutes and penalties that come into play on the average drug arrest that might come into play here?
Go ahead.
Mr. Chairman, Mr. Co-Chairman. I think that is a good question. And yes, I mean, really, this is, it's pretty specific to, the crimes that you can be immune from are just the, is this subsection C under 35-7-1031, that's unlawful for any person to knowingly or intentionally possess a controlled substance unless it was pursuant to a valid prescription. So I think yes, someone could potentially face penalty for distribution if those facts were to be borne out, and really I can't speak specifically to what other potential charges may arise if someone were to call and seek immunity under this, if they were looking to get medical help for themselves or another person who is experiencing an drug overdose event. But that's something, definitely could look into for more. Thank you.
Further questions for LSO? Seeing none, seeing no hands. Oh, you gotta raise that hand way up down there. Go ahead, Representative Ward.
Thank you, Mr. Chairman. Just a question, how would this act or this proposed legislation apply if a person, say, did this repeatedly? 10 times, 5 times, they 10 times called for help because they had an overdose. I mean, I don't see any provision in there that would prevent that sort of thing from happening. Can you comment on that?
Lucas, go ahead.
Mr. Chairman, Representative Ward, no, there's not currently anything in here that specifically says, that this is limited to, a specific person can only call once. It just provides that, that they have to, in good faith, and make the call, and then they have to follow all of those specific conditions. Trying to see here. Yeah, and it just really states that the immunity from prosecution is for these 2 offenses. It's only those 2 offenses. Yes, and then one of the specific conditions, right, that they have to provide a description of where it's happening. They have to stay and speak to law enforcement, provide that kind of information. And then, it's just required that the offenses that you can be immune from prosecution from just is required that it arises from the same course of events as the drug overdose event, but that would be for, I believe, for that specific instance. So it's a separate time and place. I think it's valid that it may be, yes, you could call again.
Follow up, Representative Ward.
Thank you, Mr. Chairman. I might suggest our committee might want to consider some limit there, 3 times, 2 times, something. So I assume a limit could be added. Is that correct?
I bet you're gonna be working on an amendment. Yes, okay. Any comment, Luke?
Mr. Chairman, Representative Ward, I no specific comment. I think, it would just be finding the right language for that.
Very good. Further questions, comments, committee? Seeing none else. Or Senator Hutchings, go ahead, ma'am.
Thank you, Mr. Chair. I too like that idea of a limit to this. And I see that all these incidences, specifications in 1, 2, 3, 4, 5 on pages 2 and 3 have to fall into place. So if I call, but I leave, I can still be prosecuted. Or is that the case? And this is to Luke.
Comment, Luke, go ahead. Yeah, go ahead, Luke.
Yes. Mr. Chairman, Senator Hutchings, yes, how the bill is written, yes, is that they are immune from prosecution if they go through, there's these 5 different factors that they must meet to be able to receive immunity from prosecution for these 2 specific crimes.
Very good.
Follow
Senator
up?
Hutchings, follow up.
Thank you, Mr. Chair.
Go ahead.
Where did this whole idea come from, if you don't mind me asking? Thank you.
Are you asking Luke or are you asking me?
Luke.
Yeah.
Luke, where did it come
Luke, go
from
ahead.
that we wanted to offer immunity for drug overdose reporting? Was this an individual bill? Was this something that someone just said, hey, let's work on this? Where did it come from?
Go ahead, Luke.
Mr. Chairman, Senator Hutchings, I apologize. I don't know right off the top of my head. This was this is based on a previous bill draft. And I know I've looked at that one. I believe it was brought forward by someone else. And I'm sorry, maybe Chairman Zwaniter knows better.
Chairman Zwaniter, our chief historian. Go ahead, Chairman.
Well, I actually believe I co-sponsored this in 2017, and it failed by a couple of votes. And so during interim topics, certain groups brought it forward and said more and more states have now passed similar laws. It was part of a package of bills 6 years ago, and we started down the road of giving people Narcan and other opioid abatements and really trying to get people into treatment as part of a lot of states' efforts on the opioid epidemic. So it was brought back this year in interim topics as part of the pharmacology kind of suite of issues to deal with, and that's why it's before us today.
And I believe, and I could be wrong, Senator Zwaniter, Representative Chairman's answer, that this idea was, in that year, was talked about in the opioid task force as well. And that's how it came out as being an individual bill as well. So that was our history lesson for the day. Further questions, committee? Seeing none. Okay. Ms. Davis. Welcome. We trust you enjoyed your drive over here.
Good morning. I did. Good morning, committee. I'm Jen Davis. I work in the governor's office as the Health and Human Service Policy Advisor. And I just have brief comments to share with you all today. I know that this is a big topic as we talk about the opioid epidemic and the mental health work that has been going on throughout the state, both in the executive branch, the legislative branch, and the judiciary, and that this is part of that conversation. At this point, the governor has not taken a position on this particular bill, waiting to see kind of what it looks like. There are lots of varieties of this across the country, as you all know and have looked at, and he just encourages this committee to continue to look at this bill, what we want it to look like, what does it make sense for the constituents of Wyoming. And we know that liability is sometimes can be paralyzing for some individuals to act. So making sure that all of that is in consideration as you guys move forward and look at what makes the most sense for Wyoming and what has worked in other states and what hasn't, so that our bill meets the intent of what you all want to accomplish. So those are really his thoughts around this bill at this time.
Very good. Questions for Ms. Davis? Seeing none, you're off the hook easy this morning. Don't get used to it.
All right, thanks.
Okay. Public comment. Anyone here or online wish to testify towards this bill? Oh, there must be somebody online.
Andy Somerville.
Andy Somerville. I hope you get feeling better, Ms. Somerville. Go ahead and introduce yourself and tell us how you're doing.
Thank you, Mr. Chairman, members of the committee. Andy Somerville, Executive Director for the Wyoming Association of Mental Health and Substance Abuse Centers. And apologize, my comments will be brief. They're going to last as long as my voice holds out. So I apologize for not being there in person, but didn't think you guys wanted me to share this with everybody. Specific to the bill, Mr. Chairman, members of the committee, we appreciate the work that LSO did in drafting it. It looks very similar to the bill that was run back in, I believe, 2017. It's pretty narrowly drawn compared to some of the other states' laws in this area regarding only providing immunity for possession and or use of a controlled substance. Mr. Chairman, members of the committee, we won't go over everything again, just to say that Wyoming is the last state that does not have this type of law in the books right now. We know that it is a barrier for people calling and seeking assistance. And that is frankly the first step to getting people treatment. Is we need to keep them alive. We need to get them into the resources they need to provide some help. Mr. Chairman, we do, I believe, have Alan Thompson from WASCOP available, who might be able to answer some of the more specific law enforcement questions. And with that, I would stand for any questions from the committee.
Questions for Ms. Somerville? Seeing none. Looks like you're off the hook easy too. It looks like your voice just gave out.
Thanks.
Thank you for coming today. And is the other gentleman online? Let's bring him in.
Well, Alan Thompson, there he is.
There, Mr. Thompson. Go ahead, sir.
Mr. Chairman.
Introduce yourself and the floor is
Thank
yours.
you, Mr. Chairman. My name is Alan Thompson. I'm the Executive Director of WASCOP, which is the Wyoming Association of Sheriffs and Chiefs of Police. We just actually discussed this proposed bill at a board meeting yesterday, and our general feeling on it is there's adequate guardrails in there that I think allow law enforcement to continue their investigation and yet encourage people to seek medical care in those life-saving those times where an overdose appears to be forthcoming. The thing that I think the most in the discussion this morning that's important to point out is, we have fentanyl in Wyoming right now that is one of the most dangerous drugs our law enforcement officers have worked with out in the field. The ability for law enforcement officers to be become contaminated, just, touching a substance and so forth. I think the one thing about this bill is it could encourage honesty from the people that we're dealing with, and maybe even save the lives of officers if that honesty, if they're being honest with us. There's plenty of guardrails, as I'd mentioned in there, that allows law enforcement to continue the investigation. So just because we wouldn't be able to prosecute someone for possession or use of a controlled substance doesn't mean that we can't apply for a search warrant and investigate further into the source of that drug, to see if other people were involved in it and so forth. So it appears to allow law enforcement to continue that investigation. Another thing I would like to point out is, I don't believe that we have hospitals or other entities right now reporting people coming to their facilities to seek treatment just for simple use and possession of a controlled substance. So I don't see this as a way to lose out on prosecution of people that need to be involved in the criminal justice system. If anything, it would encourage people to do the right thing and, as Ms. Somerville pointed out, get on that path towards treatment. I'd be happy to answer any specific questions the board may have, Mr. Chairman.
Thank you, Mr. Thompson. Questions, committee? Go ahead, Chairman Zwanser.
Thank you, Mr. Chairman. And Mr. Thompson, I don't know if you heard my earlier question, but when you do investigate one of these scenes and charging decisions are made, this bill immunizes but possession and use doesn't just give immunity for distribution. My overall question is, what other charges historically happen at the scene of a site when you go find a suspect who's overdosed and there may be a party, et cetera? Are there broader categories we should be offering immunity for, or do you feel like these two are the specific ones that get charged most often?
Mr. Thompson, go ahead.
Mr. Chairman, that's a good question. If we had a whole panel of law enforcement, I think we'd come up with a few answers to your question. But a typical investigation like this, if we were at the, say, a residence or apartment where the overdose is occurring, we're called there along with EMS. You would have things like plain view. So, if there was another crime that was occurring, maybe drug related, maybe not, there would be some other factors. But I think what this gets at is just encouraging those that are using a controlled substance to seek treatment for themselves or for their friend and not face those misdemeanor charges. Now, I think there was some discussion earlier about delivery of a controlled substance, and this doesn't cover that. So this still allows law enforcement to continue that investigation and try and find the source, work the case up the chain, as we like to refer to it. But off the top of my head, I don't have any recommendation for additional statutes that we want to encapsulate in this.
Thank you.
Very good. Further questions, committee? We got one here too. Representative, go ahead.
Thank you,
Representative Penn.
Thank you, Mr. Chairman. Mr. Thompson, one of the concerns that I'm having with this is the fact that the person who calls, if they can call for themselves and still get the immunity potentially. Do you see that as any sort of a problem? Could that be abused if I am on, using drugs and then I make a call for myself? Is that a way that could be abused to get out of charges?
Mr. Thompson.
Yeah, thank you, Mr. Chairman. I think that is a possibility, but I also think that same person is probably seeking medical assistance outside of calling 911, either getting a ride to the ambulance or getting a ride to the hospital or something, and still doing that. So if anything, this might increase faster response from maybe EMS or even law enforcement. And I'm not sure until the law is enacted what that impact would be on repeated instances. And additionally, to answer a question that was fielded to the committee earlier, the tracking of non-law enforcement actions is very difficult. So on a local level, if we dealt with someone over and over and over again in a small agency across Wyoming, we would know that, okay, this is the 5th time that they've done this or the 6th time they've done this. But in general, we're not tracking tickets we never wrote or arrests we never made. So that would be very difficult.
Very good. Further questions? Senator Hutchins.
Thank you, Mr. Chair. Mr. Thompson, you were with the organization chief of, what was it, police or sheriffs?
And Mr. Chairman,
Mr.
my
Thompson,
organization is WASCOP, which is the Wyoming Association of Sheriffs and Chiefs of Police.
Awesome. A quick question. I did hear you say, if correct, that these charges that these people would be exempt from are misdemeanors. What are, if found guilty for these misdemeanors, what would be the sentence on these?
Mr. Chairman, thank you, Mr. Chairman. I don't have that statute in front of me, but it's less than a year in jail and less than $1,000 fine for those two misdemeanors.
Thank you.
Further questions? Representative Yin.
Mr. Chairman, thank you, Mr. Thompson. So I've heard some concern from my colleagues that if there's a pattern of abuse, it could undermine the law. So, but reading through this bill, do you think if a local law enforcement really recognizes that there is a pattern, do you think that would be a good argument in court that it isn't actually a good faith seeking of medical assistance and they could ultimately be prosecuted if a law enforcement officer thought they were actually abusing the law?
Mr. Thompson.
Yeah, Mr. Chairman, I mean, that's a hard question because it's very situational. I just kind of look at the overall bill language and look at the guardrails, like on page 2, line 22, it starts with that cooperation. And it says the person cooperates with the responding law enforcement officer, emergency medical service provider, or medical care provider, on and on, including all those things like the type of substance that may have used and the drug overdose event. That's very compelling language in there. And that honest and open statements from them they're very tight guardrails. And I feel like if we were dealing with someone 5, 6 times, they would not fit within some of those guardrails like that are mentioned in there. And there would be mechanisms for charging them and trying to get them into the treatment program in another way.
Further questions, committee? Thank you very much, Mr. Thompson, for seeing us today. Further public comment. Is there anybody else who'd like to comment to this bill? Somebody said, Mr. Chairman. I see no hands. Okay. No further questions. Public comment. Welcome. Lindsay, introduce yourself and tell us everything you know.
Mr. Chairman, Lindsay Simino with the Wyoming Counseling Association. I just really want to highlight 2 points that have come up this morning. The first was that we have been seeing Good Samaritan laws since about 2010 when Washington became the second state to enact Good Samaritan laws similar to this one. And as Ms. Somerville highlighted, Wyoming is the last state to do so. Since 2010, what we have seen is a possibility of 15% reduction in overdose deaths. And in a time where Wyoming is facing an opioid epidemic, as some have called it, this could be a valuable resource tool to get the treatment to those people who need it and encouraging that working relationship with law enforcement. So those are really just the 2 points that I wanted to highlight really quickly as this discussion moves forward, and I stand for question.
Questions from Ms. Semino. Go ahead, Representative Penn.
Thank you, Mr. Chairman. You said 15% reduction in deaths. How do you come up with that number?
According to the research, what they are comparing is the deaths that were occurring within the state pre-law and then post-law is really where those states are comparing those 2 numbers with the as far as when that bill was enacted. Mr. Chairman, I'm sorry, I didn't go through the chair.
That's okay.
And so that is the comparison is of those two numbers before the law and after.
Further questions, committee? Seeing none? Thank you, Ms. Sumner.
Thank you, Mr. Chairman.
Further public comments? In the room, out of the room? Outer space? See no public comment will close. Committee. Go ahead, Representative Ward.
Thank you, Mr. Chairman. I'd like to move an amendment that would limit the use of the immunity listed in this proposed statute to 2.
Let's move the bill first. Okay, we got the bill moved.
Second.
Okay, and second. Now go ahead, Representative Ward.
Thank you, Mr. Chairman. I move an amendment that would limit the use of the immunity provisions here to 2.
We have a move and a second. Discussion, committee.
Mr. Chairman, just as a
Representative
matter
Young.
of procedure, did we need to move the bill first?
Excuse me?
Did we need to move the bill first?
We moved the bill.
Oh, okay, so
Yep,
my
we moved and
apologies.
seconded it. We're very efficient today. Okay, comment on the amendment that's before us. That was 2 times, is that correct? Go ahead, Chairman Swanson.
Thanks, Mr. Chairman. I'm just thinking quickly. So then you would have to document a call happened and they were not charged with anything the first 2 times. And I assume they'd tell the perpetrator that the 3rd time they would be liable and that may dissuade them from calling. I mean, I just see there's an opioid addict. They're trying to stop, we hope. They're hopefully in treatment and, you know, something happens, they relapse and they have a fear response and they say, hey, I might not make it. I want them to have the full potential of, I mean, nobody wants a repeat offender over and over and over and who every time they have an issue calls the police and protects them. I'm just trying to think through the ramifications and I'm not sure, A, on the documentation of here's your 2 strikes, but you call us again, and you're out, if that sends a chilling effect. And then the documentation of, well, and is that within a year or is that within a lifetime? I mean, there's just some questions that would need to be fleshed out a little bit more. The concept I think is fine. The details are giving me pause. But if there's some thoughts on that from the committee, I'd be welcome to hear them.
Representative Yen.
Mr. Chairman, I actually think the biggest issue for me on this amendment is what happens when you have a group of people, right? So someone is doing drugs with their friend starts overdosing. So that person should be calling the police to get help for their friend or calling EMS to get help for their friend. But they have called for themselves or someone else 2 times before. So now they're not going to call for their friend. I think that's not something that we necessarily want to incentivize if we're going to bring forth the Good Samaritan law at all.
Further comments, committee? Discussion, Representative Ward.
I would be open to amending my motion for an amendment to apply only to the individual and not to who the individual might be calling on behalf of others. I'm not sure how to put that into language, but I'm open to the idea. So I amend my amendment suggestion.
Possible to withdraw the amendment and have a restate?
Would that be welcome? Representative Ward?
I withdraw my original amendment and I further move an amendment that would limit the number of times per individual to 2 per year. I'll give a year. And not applicable to people the individual might be calling on behalf of. Hopefully LSO understands my concept.
Friendly.
So I move that motion.
Okay, do we have a second?
Is it second friendly?
We have a second on that amendment as changed.
Second, and then as the original second, are they friendly to this?
Okay,
Okay.
so we have friendly. Okay, everybody's friendly.
Making sure we're friendly.
Okay, for discussion on the revised amendment, committee.
Woohoo, woohoo.
Senator Hutchins, woohoo, go ahead.
Thank you,
As long as
Mr.
you're
Chair.
friendly, you can talk.
And I'm sorry, but I've noticed a few hands that have stayed up there for quite a long time. You know, I think it's wise to have limitations on a bill like this. Number one, the average person who's on drugs isn't going to care about the law. because they're doing something unlawful anyway. But by having a limitation, it does provide a little common sense to, I think, laws. So people that do pay attention know that, hey, if you're going to continue to act this way, you are going to suffer the consequences. If we continually allow people to do things over and over and over again, then we're going to become a lawless society. So I'm all on and for this amendment. Thank you, Mr. Chair.
Thank you, Senator. Further discussion on the amendment, committee? Seeing none. All those in favor of Representative Ward's amendment, please say aye.
Aye.
All opposed, say no. That amendment passes. Back to the bill. Committee, further discussion on the bill.
And Mr. Chairman, is
Go
the
ahead.
motion to move it as a committee bill for 2025 at this time?
It is.
Okay, now I'll call the question.
Okay, question being called. Roll call, please.
Mr. Chairman, this is roll call for 25 LSO 0036.4, immunity for drug overdose reporting as amended. Senator Barlow,
Excused?
Senator Bouchard,
Excused?
Senator Dockstetter,
Aye.
Senator Hutchings,
Aye.
Representative Chadwick,
Aye.
Representative Klauston,
Excuse.
Representative Hornock,
We can see you, but we still can't hear you. Just raise your thumb if it's an aye. It's a down for him. Okay.
Representative O'Hearn,
Aye.
Representative Penn,
Aye.
Representative Trujillo,
Excused?
Representative Ward,
Aye.
Representative Yin.
Aye.
Chairman Baldwin,
Aye.
Co-Chairman Zwanitzer,
Aye.
nine aye, one no, four excused.
That bill will be sponsored as a committee bill for the 2025 session. Thank you very much, committee. We are now an hour and 20 minutes ahead of schedule. Chairman Swanter.
And so, Mr. Chairman, maybe even more good news. From what I understand, Representative Klauston would like to be here for the opioids discussion. He's not available until 2, as well as the presenter of some of the issues on that topic has not responded this week or the last week after asking for it and wanting a presentation, and they seem to have disappeared. And so if it is agreeable to the committee, we may push back the time all the way to 2:15. I don't think it'll be that long of a topic. I know that gives everybody a 3-hour break to enjoy Pinedale, but I think out of all the work we've done the last 2 years, we could all enjoy 3 hours of some sun. And so it'd be my recommendation not come back until 2:15.
Okay. With that in mind, if there's no disagreement from the committee, I suspect there won't be any. But Representative Yen, he's going to oppose that.
Mr. Chairman, Fremont Lake is beautiful. If you haven't gone up there, just go up there, take in the sights.
Okay. You know, if you're a good golfer, you've got time for a round of golf.
That's what I'm looking into.
Yeah. Okay. Committee, with that in mind, in public, we're going to break until 2:15. So you have time to enjoy a good lunch, a round of golf, fish, perhaps, whatever it is you want to do. This doesn't happen often, so, don't advertise this and don't get used to it. Senator Hutchings, go ahead. You can go golfing if you want, Senator Hutchings, but.
Well, Mr. Chair, I was just about to comment on how unfair these proposals are for lunch. I will be home doing laundry, and it's a shame I couldn't enjoy Pinedale with you guys, but in jest, I just say you guys have a great lunch.
We will, and we'll make it up to you, Senator Hutchings, that somewhere down the road, we will.
Thank you.
We'll
Thank you.
buy you lunch or something down the road.
All righty.
Okay, committee in public, we break until 2:15.